Hello and welcome to the Spark Study Information Session with the Watson Center Society for Brain Health. I'd like to acknowledge that we are presenting on the ancestral and unceded homelands of the Henkaminam and Squamish speaking peoples. We are grateful for the opportunity to live and work on this land. Okay, next slide, please. I'm KATRYNA KOENIG. I am one of the principal investigators for the study alongside Tess Croker and Sean Porter. Also on our amazing research team is Mild Granger, LYNNEA THORKELSON, which will introduce herself in a moment, as well as lovely folks Emily and Camille from KPU. So I'm KATRYNA KOENIG. I'm the Executive Director and Recreation Therapist here at the Watson Center. I have been very passionate about working with folks with acquired brain injuries, including concussion, for the last several years. I have been led into this role because of my commitment to rehabilitation and my belief in neuroplasticity and how to apply neuroplasticity to improve people's function.
Yeah, and I'll introduce myself. My name is LYNNEA THORKELSON. So I joined in this research study as a cognitive instructor for Watson Society. I've had a lifelong interest in the brain through the lifespan, and it's a great curiosity. I also have had experience working in long-term care and was really curious about the aging process and quality of life. So the study is a great opportunity to explore those interests and see how neuroplasticity can impact older adults.
Here at the Watson Center, our mission is to provide programs delivered by specialists for the purpose of helping people with brain injury to improve and reclaim their lives to the fullest. You might wonder how we got here. The Watson Center is really based on the foundation of neuroplasticity. You might already be familiar with this term. It refers to neurons in the brain which fire together, wire together. Really, the more practice we do something, the easier it gets, right? That is really a piece of neuroplasticity happening. So the more we repeat something over and over, the more the brain wires to do that task, that function, easier and easier and better. But all of this can be trained on new learning. We can create new pathways in the brain by targeting them, challenging them, and repeating to create that pathway even stronger. It really gives a lot of hope for folks that have neurological-based issues. And our task is to determine what type of targeted activity will make the most meaningful impact and functional change. It gives a lot of hope, but it's the application of neuroplasticity that here at the Watson Center we focus on. The Watson Center was born out of the history of the Aerosmith School. The Aerosmith School has been around for over 40 years, and it is created and developed by Barbara Aerosmith Young. This is a Canadian-based organization, and you can find Barbara Aerosmith Young's books called The Woman Who Changed Her Brain. In her experience, having a learning disability created a lot of blocks in her own development and was very frustrating and challenging to push past. In her creativity and from the inventiveness of her family history, she created incredible cognitive exercises that target specific functions of the brain and has been using this with a learning disability population for over 40 years. These schools are now across the world. And only in the recent 5 years have we been using some of these cognitive exercises with folks with brain injuries. We entered into the brain injury field after many parents advocated to the schools asking for their children with brain injuries to do the cognitive work. We weren't sure if this could help these particular people, so we started a UBC pilot project. What we found was very surprising. We found that there aren't very many organizations or programs to help people in the post-acute stages of their brain injury. This is the time when folks are back in the community. This might be 6 months, might be a couple of years since the initial injury. We were fairly surprised to find that there wasn't too much to work on improving cognitive functions. Rather, there were other programs that addressed compensation. So there was quite a gap. We really saw an opportunity to provide a meaningful program. In our years of experience running these types of cognitive programs, we've learned that commitment and engagement is the key to success. Neuroplasticity takes a lot of repetition and does take challenge. So people need to be willing and ready to commit to that time frame in order to see long-lasting and transitional changes. That's where changes not just happen in the brain for a scientist to measure, but where changes actually come to daily activities, daily function. We also know that growth mindset is an asset. That is believing that your brain can change, your repetitious behaviors can change, that we are all open to change in our lifetime. Also, really incredible thing to note is that it's never too late. We've worked with folks that are 1 year after their injury, all the way to 30 years past. Even people working in their 60s and 70s have shown changes in our typical brain injury program and in the learning disability programs. It seems that age is not a factor for neuroplasticity to take place. I want to share a little bit with you about our approach. So the Watson Center is founded on 4 different pillars of programs, 4 different pillars. Each of our programs touches on each of these areas. We're going to go into a little bit more depth about what this means. The physical exercise pillar. You don't have to read through each of these notes, but basically to say we do cardio exercise for the nerdiest reason. We do cardio or aerobic-based exercise for about 20 to 40 minutes, and we aim to get your heart rate up to about 70 to 80% of your maximum heart rate. And this can be determined with a simple math sequence. If you are ready to do aerobic exercise, we would have this activity in your program. And the purpose of getting your heart rate up to this zone for about 20 minutes is so that your brain can create a growth factor called BDNF. That's brain-derived neurotrophic factor. You don't have to remember it, it's okay. I basically call this a brain fertilizer. It helps ready the brain to create new neurons or strengthen existing connections. It's like a fertilizer for the brain, and it only stays in there for about ½ hour to an hour and a half after. So we do the exercise first, and then we move on to do the cognitive work, really targeting that BDNF on where we want to build those stronger connections. Our cognitive capacity building pillar focuses specifically on executive functioning. You may have heard executive functioning described as the secretary of the brain. It integrates information, organizes it, and plans a response. This is true. Executive functioning is the most important overreaching cognitive ability because it touches on our memory. It takes information from our memory, from our comprehension, and integrates it with our self-awareness. That way we can reason through problems, we can observe and adjust our behaviors, we can organize and plan. It really touches on activities of daily living, our ability to be independent, and our quality of life. I will mention with the cognitive capacity building, I know you probably are wishing that you could see how we do the cognitive exercises, but I cannot share that with you at this time. Just to say that the cognitive exercise we will be using in this intervention project will be one that focuses specifically on executive functioning, and it'll just be one exercise that we'll be working with. The mindfulness pillar is a very important pillar that myself and LYNNEA are especially passionate about. The mindfulness pillar really integrates just 20 minutes of time of practicing mindfulness meditation. And you might be imagining mindfulness meditation to be kind of like this picture looks like, you know, sitting in full lotus, very calm, no thoughts entering the mind. I don't want you to do that. When we start off with mindfulness meditation, we really like to expose you to different ways of practicing mindfulness meditation. There's so many, and it can even just start with noticing the chair underneath you right in this moment, just noticing that point of contact. Very simple way. So if you're intimidated by the idea of practicing meditation, I invite you to challenge that a little and maybe talk with LYNNEA or myself about what this might involve, and if you're a little bit nervous about it working for you. We really are quite accustomed to adapting and teaching just the basics of this all the way to coaching those that have experience on how to best benefit from it. We have been committed to research since the start of our pilot project with UBC back in 2015. There has not been a moment in time where we haven't been engaged in research. So we look for neuropsychological changes, quality of life, and even physical changes to the brain, which has led us to this study. We have found that we can support the brain injury community with great success based on our research, but we wondered, could we do more?
So that being said, we started exploring options of where to expand the reach of this program. And we landed upon the population of older adults who may be experiencing mild cognitive impairment. And we really wondered if these exercises can be a proactive solution to this diagnosis, and could it impact people's quality of life? So why is this study being done? Just as I said, you know, we recognize that there was an opportunity to learn more. There really needs to be more research in this area. A lot of the response to mild cognitive impairment is a biomedical model and not a proactive model. So we wanted to see if there was potential for this in terms of a solution to slowing the progression of cognitive decline. We want to gather data. That's why we do studies. Data really helps us to understand the significant impact of something or not. And there's so much potential for this research to impact the individual who may receive this diagnosis of mild cognitive impairment, the medical system that supports that individual, and of course the family system around that individual. Quality life isn't just one thing, it's a lot of things. And so we really wanted to keep this in mind as a part of the study. So that is the marriage of cognitive decline and quality of life research. So who are we looking to participate? We're looking for individuals 65 years or older, BC residents. We are looking to specify our study around age-related cognitive decline. And so we're looking for otherwise healthy adults who are showing this cognitive decline impairment in their life, but that don't have a history of any brain-related injuries or neurological conditions. These might include MS or stroke. And because we're in unique times and we're offering this program through a remote delivery option, we are asking individuals to have access to the computer, internet, and a basic computer literacy. That being said, we're more than happy to support people through the learning curve of technology. We're also in it as well, using platforms and learning that process every day. A little bit more about the study groups involved in the study. So after participants will be screened, so screening is a 15 to 20 minute eligibility phone call, and this phone call involves some information gathering in regards to health and also a cognitive assessment. So if people have passed through that eligibility phase, they will be randomly assigned to one of two groups. The first group would be the intervention group, and this group completes the non-invasive assessments at the beginning and end of the study. Non-invasive meaning no blood is drawn or no physical assessments. It's simply going through checklists and survey type questions. This group will participate in the cognitive program, and this is a commitment of 3.5 hours a day, 2 days a week. And that time period is the structure of the program that KATRYNA spoke about here, with the with the physical exercise first, cognitive exercises, mindfulness, and once again, cognitive exercises, which I'll show you a little bit about later. And this group will also complete the non-invasive assessments after 6 months. So the non-intervention group, this group completes the non-invasive assessments at the beginning and after 6 months, but they do not participate in the program. So these folks will go about their daily lives, engaging in their normal activities in terms of social, intellectual, and we do ask that these individuals keep a journal of their activities for the duration. We're really curious about what people are doing in their lives and how that may impact or relate to their quality of life. And the third group in this study is a focus group. And this focus group is intended to provide the researchers a little bit more information about the context around the individuals in the study. So these participants are identified by those in the intervention group or non-intervention group. And those individuals will participate in a 60-minute session with a researcher. These will be small groups, and confidentiality will be something that we make an effort to ensure throughout that process, throughout the whole process of the study. So as I spoke before, remote access, we have a wonderful opportunity in these unique times, given the technology that these times have also afforded us. So we are looking to deliver this study, working through the COVID challenges. So engaging in your home and providing this structured and live experience through the computer and internet. So here's a little bit more about the structure of the program. So KATRYNA spoke about all of these different pillars and why we do them. And this is how it will sort of roll out on those days in the program. So the physical exercise portion will be engaged independently under the remote guidance of a personal trainer, and that's Niall, who's a part of our team at Watson. The goal of this exercise is to raise the heart rate and, as KATRYNA spoke about, allow BDNF to start flowing and support the cognitive work that will come next. The cognitive block then will occur after a brief check-in online. We will sort of do some goal setting and see where everyone's at. And the cognitive block will be delivered through the ABI Wellness platform. And the group facilitator will be available in the group chat, in the video chat, as necessary for support and encouragement and orientation to the cognitive exercises. Then we'll flow into the meditation, which is a nice pause, a moment to gather ourselves, our thoughts. And this is guided through the facilitator, myself, or an external audio link that we'll all experience together. Then we'll flow right back into the cognitive block for another hour, get lots of good neural pathways happening, and of course have a group closure at the end. Comfort breaks, of course, will be taken as needed throughout, but we do emphasize in that chunk of time, in that 3.5 hours, that people really try to maintain consistency and of effort, because we know in terms of getting the brain making new pathways, that consistency is very important. So you might be curious, what is the benefit to all this? Well, as a participant of research, you are supporting to advance science, which is so important and so necessary, and it has the potentials to support older adults with mild cognitive impairment. Another benefit is having access to the renowned cognitive rehab program that Watson delivers at no cost. And also a wonderful opportunity to have structure that involves physical, cognitive, and social engagement through the next 6 months, which is great. Our recruitment for the study continues. So there's some information here, a little bit just highlighting the bullet points of what we are discussing today. The commitment. If you are interested or curious to know more, we do really invite you to be in touch with us, express your interest, or even if you know someone, perhaps you're a service provider who also supports the older adult population, and you may have some people in mind, we'd be so happy for you to share the information about the study with them as well. So last but not least, of course, we want to thank everyone, thanking our entire team. This couldn't be possible without the support of Center for Aging and Brain Health Innovation, who offered support through their Spark grant, Kwantlen University, and ABI Wellness.
And thank you everyone for joining us through this recorded webinar. Please reach out if you have any questions or if you'd like to go through the screening process, the first step in becoming a possible participant in the study.